Hello again, everyone. Today I wanted to talk a little bit about a recent event in Congress where testimony was taken from multiple different experts in the field of pain management, as well as from a patient and a national advocate, someone who daily struggles with chronic pain. And I think it was an amazing experience, an amazing thing that happened in Congress where lawmakers were able to really listen to the realities, the struggles, the difficulties in providing care, but also the struggles that a person with chronic pain themselves faces on a day-to-day basis. So we will certainly put a link to this testimony. It's about 2 hours long on our Facebook page, our LinkedIn page, and I'll include a link with this post as well. But I wanted to start a series today talking about the points that were discussed during this testimony. There is so much information here and there are so many things to talk about. It's going to be an ongoing series throughout the rest of the year. But today I just wanted to highlight some of the major talking points that were brought up during this testimony. So the members of the panel that testified, one is a pain management expert from Mayo Clinic, another is a pharmacist, another is a Blue Cross Blue Shield insurance executive, and finally, Mrs. Steinberg is a lady who suffers from chronic daily pain, but is also a national advocate. And so we'll kind of break down these videos based on how they testified through each of these people. One major point that came out was the importance of developing an individual treatment plan for each patient. As I've said before, it boils down to finding the right diagnosis and using the right treatment for the right patient at the right time. It's important to realize the individual needs of each person struggling with chronic pain, and that can inform each treatment decision we make, and specifically the need to use opioids and what levels for management of their chronic pain. Another aspect of treating chronic pain was the importance of taking a multidisciplinary approach. And we've talked about that here before, and I also wrote a blog about it on the Javery Pain Institute website. But this means involving multiple different specialists, multiple different care providers to get at your pain, to treat chronic pain from as many different angles as possible. Another important aspect was collaboration, specifically between physicians and pharmacists. We need to think about how we are developing safer medications to treat chronic pain, but also how pharmacists are also looking out for the safety of the patient, yet at the same time need to collaborate with physicians when decisions are made about access to medications like opioids. Another aspect was the need for insurance companies to adequately cover pain management therapies, and this includes opioid-sparing therapies like physical therapy, possibly acupuncture, massage, the interventional treatments that we provide as pain management specialists as well. I think the testimony really highlighted something we've talked about in the past, where collaboration between care providers like physicians and insurance company executives and administrators is so important so that we both understand the angles that we're approaching this from, both treating the individual patient but managing population health and the need to see this problem from both different sides and collaborate in the best interests of the patient. Finally, the testimony from Mrs. Steinberg, again, a patient who struggles with chronic pain but is also an advocate, was so amazing, and it was just really engaging, and it was important to hear her statements. She emphasized the need for empathy and how when she finally heard empathy from a physician, she was able to establish an excellent treatment plan for her chronic daily pain, and also the need for education, both for providers and people who suffer from chronic pain on a daily basis. Education is so important to set expectations for how you're going to live with chronic pain the rest of your life, since chronic pain is a diagnosis and a disease in and of itself. And she brought an amazing perspective that we look forward to getting more in depth into what she's saying and how we as physicians and patients can collaborate. So I look forward to talking with you more in the coming weeks and months about this amazing event and this testimony, and we'll break down all the elements that they talked about during this 2-hour testimony so that we can kind of move forward together, educating and understanding how we can better manage chronic pain in our country in the near future. Thanks so much.